The 2-Minute Cardiology. I'm here with one of my favorite shirts, a Bronx Rescue shirt given to me in 2000 by a firefighter. Many of those firefighters would pass away in 9/11, and my patient actually passed away from heart disease, but a great man, and I saved this shirt, and I feel proud to have it. My wife says I have more holes in it than a fishing net, but I still keep it. Anyway, we're going to talk about pravastatin, the Forgotten Statin. Pravastatin was one of the first statins. It's not as potent as some of the newer ones, but guess what? It went generic, and the newer, more potent ones, you heard of Lipitor, Zocor, and Crestor, they took over the market, and they are more potent. So if you have coronary disease, you got to use those more potent drugs. But for most everyone else, a drug like pravastatin is fine. And why would you want to use that? Well, first, if you have a 7.5% risk of having a heart attack in 10 years, most of your doctors will put you on a statin. What's wrong with pravastatin for most of us? First of all, it's less likely to cause those aches, those terrible aches and pains and myalgias. So that's great. And it also is less likely to interfere with all those drugs metabolized in the liver. So it's safer as well for that. And it nevertheless is a pretty potent drug, even though it's not as potent. You'll get a 32% reduction in your LDL at the standard 40 milligram dose. And it's extremely well studied in that primary prevention trial. Primary prevention means you never had a heart attack or coronary disease and you want to prevent it. Secondary prevention is another story. You need the more potent statins. So I think I'm going to start reaching more for pravastatin because it's less likely to cause the aches and pains. And once people get aches and pains, they don't want to try another statin. And if you look at the numbers, there's only 15 million Americans on statins, and people estimate that up to 30 million should be on a statin. So why not try for those primary prevention patients pravastatin? You may want to speak with your physician about that. If he's going to start you, or he or she is going to start you on a statin for primary prevention because you just have a little bit of a higher risk, that's 7.5% risk of having a cardiovascular event in 10 years. Maybe consider pravastatin first. Have a great day.